Hello, everybody. Welcome to our event today, promoting health on campus during COVID-19. Almost 2/3 of colleges are planning to open their campuses in some way, shape, or form in about a month. Some have been open for programs during the summer. First wave COVID infections are spreading during a period we hoped would see some relief before a possible second wave in late fall, and contagion might be fueled further by hundreds of thousands of students crossing state lines and taking planes, trains, and buses to get to college. How can colleges get students to follow social distancing, PPE, dining, and residential requirements? We've gathered campus leaders and public health experts to review how campuses can operate safely. I'm Alexander Kafka, a senior editor for the Chronicle of Higher Education. The behavioral and logistical challenges for the fall semester are daunting. Fortunately, we have an incredible group of panelists today who are not easily daunted and will explain how their campuses are planning to meet these challenges. Before we get started, a few housekeeping notes. Please send us your questions or comments in the chat box at the bottom of your screen. For security reasons, we will be screening those before they go live, so please have patience with us. I plan to include your questions in the second half of the panel. Also a reminder, this panel discussion is being recorded. We'll send an email with the link to the on-demand version in a few business days. That email will also include some Chronicle reports and other resources that are shared during today's conversation. If you're having a technical issue, please send an email to connect@chronicle.com, and a Chronicle staff person will help you with any issues you're having. Our thanks go out to the underwriter of today's broadcast, One Medical. We really appreciate their support in helping us bring this conversation to our audience. Now let me introduce our panelists in alphabetical order. Deborah Beck is the Executive Director of Student Health Services and the Healthy Carolina Wellness Program at the University of South Carolina, where she is also an Associate Professor in the School of Public Health. She is a member of the COVID-19 Task Force of the American College Health Association. Robert Pomales Miranda is Executive Director of University Health Services at the University of Massachusetts at Boston. Those include general medicine, the counseling center, and wellness programs. Angela Socha is the Interim Executive Director for Student Health and Well-Being at the University of California at San Diego. And Samantha Smith is the Assistant Director of Health Promotion for the University of Maryland, Baltimore County. Before joining UMBC, Smith worked with the United States Army Public Health Center. Pamela Zarkowski is Provost and Vice President for Academic Affairs at the University of Detroit Mercy. I'm also going to introduce my colleague Liz McMillan, a Chronicle editor. About halfway through the broadcast, we'll show it's actually about a 10-minute pre-recorded sponsor interview that she'll have with a physician from One Medical. After that, we'll jump right back into our panel discussion. So let's get to it. Angela, let's begin with you, please, because not only does UCSD have an ambitious, intensive testing and contact tracing plan for students, staff, and faculty returning in the fall, but you've also had a head start this summer. Can you summarize what UCSD has done, how it's been working out so far, and what you've learned from it?
Happy to. So one of the things we feel that will help our campus stay safe is intermittent surveillance of the campus community, in addition to very active symptomatic management. Any student or campus faculty member or staff who has symptoms to get ready access to testing. So that is kind of key to our approach. With that large-scale testing of many individuals periodically, we felt operationally could be most effectively done if we could do self-administered testing rather than provider-based testing, it would also minimize the amount of PPE that was required. So earlier this summer, late spring, we did a pilot with our students living on campus, offering them the opportunity to self-test through a nasopharyngeal mid-terminate swabbing with an instruction path that they followed, and they self-administered the test. And just under 1,500 students chose to do this test and were successfully tested in the process. So we were able to demonstrate large-scale testing, self-administered testing, rapid results to the students. We used the health systems laboratory. Results were back within 24 to 36 hours for our students, and they received those in their medical records. So it was our first foray to demonstrate large-scale self-testing.
Got it. Yeah. And I've been reading elsewhere about tests taking 7 to 10 days to come back. And so having that capacity on your campus is a huge advantage. Debbie, the University of South Carolina is moving full speed ahead for this fall, but with an incredibly detailed contingency plan. And I would urge folks watching this to check that out, because it really does look at so many factors and so many things that can go right or wrong. Columbia had a COVID flare-up over the summer attributed to young people socializing downtown, obviously not just students. What has the university learned from that in terms of planning for this fall? And
I think one of the most important things that we have done on our campus, first of all, the health and well-being of our community and our campus are the utmost important with all of our goals and how we're working through. So we have started a system on our campus. It's I Pledge Columbia. So we are asking all of our students to make a pledge to come back safe, making sure that they are going to be doing our mitigation strategies. They're going to wear a mask throughout our campus. They're going to wash their hands, and they're going to take care of one another. So although much like other campuses, as students start returning to the community, there will be an increased number of students with COVID in the community, but we're just making sure our students are responsible and making sure that they understand the impact of our community. And we've had a lot of extremely positive results from our students and their behavior.
Rob, UMass Boston is taking a very cautious, minimalistic approach to reopening, with about 350 students living on campus and an additional 500 or so coming onto campus for a limited number of classes and labs. Even given that, you have resources and personnel at the ready for quarantining and contact tracing. Why did the university take this approach, and who are those few students who you've determined should live on campus?
Well, our primary concern obviously was being able to create a safe environment for the students that we did have on campus. We are primarily a commuter campus. We only have about 1,000 residential beds. And we thought that the nature of our campus, the dependence on public transportation for most of our students, many of our staff, really made the decision to drastically limit the number of people physically on campus the best possible way of ensuring the relative health and safety of the campus community. But we know that there will be great need. Many of our students actually rely on our health services for primary care. And that doesn't change if they're not on campus and they live in the general vicinity of our campus. So we are preparing to have our full scope of services available, primarily through a telemedicine modality, but we will have on-campus care and satellite COVID-19 clinic, where all of the students who present with symptoms will be diverted for care there. And all of our testing, because we will also be doing some surveillance testing of those students who do come to campus, will also be done at that location. Primarily, the students are those who are engaged in classes that require labs. And in our case, it's primarily our nursing students who will be in person.
Rob, if I remember right, you and your colleagues identified one of the first COVID cases in Boston, right, in your region.
We identified the 8th case in the country and the first one in the East Coast. So yes, we have been, since January 29th, we have been thinking about and preparing for COVID-19.
Yeah, there was an excellent Boston Globe article that talked about how your experiences there sort of flowed into the whole regional management of COVID. It was really interesting. Pam, Detroit Mercy's fall plans involve a lot of self-reporting and self-monitoring in a partly commuter campus, lots of folks coming and going, and in a city that has also been hard hit by the virus. You're asking students and others to be keenly aware who they are in contact with in case contact tracing is necessary. How can you get all the parties involved to buy into these behaviors and take the situation as seriously as needed?
I think we're doing a couple things. One is similar to what's been mentioned before. We have a sort of motto or theme that we're using called Titans Together. And that has resulted in a web page being created that has a lot of very important information in it. But as part of that, we're also going to have our employees and our students sign a pledge. And I have a number of different individuals. We have 3 campuses here at Detroit Mercy. So 3 different campuses working with their faculty, staff, and administrators to make sure that we educate everyone about our expectations, about, as you mentioned, working together and supporting each other so we too can have a healthy and safe environment. So we're doing a couple of different things. We have a variety of activities that we're planning for the fall, everything from freshman orientation through faculty development, having a plenary session that talks about 10 things you need to know as you return to campus, trying to highlight important information that every employee needs to know, as well as we're developing a video that students can observe what their roles and responsibilities are. But more importantly, we've also been working with faculty to develop some very key policies that address things such as classroom etiquette, that discuss things such as our expectations. And so through a number of different venues, whether it's a department meeting or an academic unit meeting, student organizational groups, orientations, and then of course, videos and media really are quite helpful. We have found as well that not everybody reads the web page, no surprise there. And so we're relying quite a bit with FAQs and using, and I may not get this all correct, but Instagram and other ways to communicate with students, for example, using a method that we know they may pay attention to. So I would say some traditional ways of educating folks and laying out expectations, as well as using modern technology to reinforce some of the various things that we have and the expectations that we have as we return to campus.
So some social media reminders on
Yes.
Insta or TikTok or whatever it is your students are following.
Exactly.
Yeah.
And we have signs in different places, kind of standardized templates, encouraging people, whether it's on the floor or a wall or a doorway. So those reminders are just as helpful as somebody walks into a building. So
Yeah.
Traditional and not so traditional, I guess.
Got it. Samantha, you're an expert in student behavior and how most effectively to influence it. You and I have talked about seeking students' compliance through telling them what they can do rather than what they cannot do. Can you explain a little bit to our audience how you decided that that's the best approach and what that means in terms of your practical on-the-ground planning?
Thank you so much. So when we're talking about things that students can do, we wanted to take that approach because if we continue to tell them what they can't do, they will just gradually make their way back to the things that they can't do. And so not that they want to be deliberately rebellious in any state. Our college students are still very exploratory, and so they're figuring out a lot of things on their own, but they're also looking for entertainment. They're looking for ways to socialize, and we're using a low density model on our campus, which means that And I've told my colleagues is that somehow the students who are going to be in our residential space are going to find themselves congregating in one way or another. And so how we can help them to do that safely is going to be the best way to get them on board with us. We're asking them to do quite a few things that we've never asked them to do before, which is going to be wearing a face covering when they're inside of the buildings, maintaining space between one another, not having a roommate, or getting to have that first year experience that they would normally be anticipating. And so when we're asking them to, when we're taking away a lot, we want to give them some options too, because they're still students. And we also know that some sort of socialization, ability to connect with one another is actually going to improve their health and well-being over time. We know some of our students are dealing with stress, anxiety, and depression, and we don't know how COVID-19 is impacting them, either as an individual or family or loved ones. And so if we can promote some of the good things that we want to have them engage with, like belonging, happiness, purpose, meaning, that might actually help us to combat some of the underlying and invisible health outcomes that we don't want our students to see, like loneliness, depression, which can ultimately lead to students not returning to the university or not finishing their semester with us.
Thank you for that. Pam, if you would, tell me a little bit about how Detroit Mercy is approaching testing. Who will get tested? How often? Will it be voluntary? Will it be mandatory? What kinds of guidelines are emerging for you all?
So we, as you mentioned earlier, Detroit was significantly impacted by the pandemic. And so testing began in different locations throughout the city of Detroit and outside of Detroit rather quickly. And so the university has been working with the city of Detroit in terms of where those tests are available. We are going to make them available to our employees. And so our current policy talks about if you feel that you're in a certain risk factor, or if you have symptoms and need testing, we have a certain amount of chits that we can use to allow our employees to get that testing done. As far as our students, they would be working through our wellness center. And again, they will be working with that student to make a determination as to whether testing should be done. And as was mentioned with some of the programs that have athletes returning, there's also a whole protocol within the athletic department. And so the testing is available. We're not making it mandatory for everyone at this point. We also have a School of Dentistry here, as well as the Health Professions College, as some of my colleagues have different units that are providing care. And so if there is patient or client care involved, each of those units are coming up with specific recommendations as it applies to a patient, and what that testing might look like if someone is seeking care, or if they've been exposed to COVID, or they themselves have had COVID. And so we've come up with a protocol and guidelines about what kind of negative testing is required before, say, a dental patient can be seen. And so there's, I would say, subcategories to this idea of testing, with employees and students first, and then patients and clients at a different level.
Got it. Thank you for that. I'm going to try to slip in one more question before we go to the sponsor interview. Dr. Beck, let me direct this to you if I may. The Carolina contingency plan includes thresholds of fear and unease among faculty and staff. Would you explain to us how not just the physical medical realities, but the psychological ones have factored into your university's planning?
Absolutely. Thank you for asking. Well, our planning group really consisted of the entire university. We've had special groups talking about different focus in the areas, whether it be planning, mitigation, admissions. But one of the things that we really talked about is we wanted to make sure everyone on our campus felt comfortable coming back. And that goes into our faculty and staff, and whether or not they have a fear of being on campus. So our president was very much straightforward that if you do not feel comfortable on our campus, we understand, and we're going to provide whatever we can for you to supplement your ability to work from home, whether that be equipment or help with the instruction in the classroom. So it's been very supportive of that the faculty and staff working from home and doing remote learning. So I think that was really important. And as South Carolina continues to have an increased number of cases, we continue to have faculty and staff that may have some fear about being on campus. So we have really changed the environment very much on our campus to use what we call sneeze guards, putting things in, but we also have everywhere across campus, you'll see it's social distancing. We have separated our classrooms significantly. All of those classrooms that have more students than we feel like that we could physically distance, they are all online. So we've really done a lot to help our faculty and staff feel comfortable. But I think most important is we invite them in at least 3 times a week to talk about what are your fears, what are your anxieties, what is it that we can do to kind of help you overcome that fear and anxiety. And oftentimes it's lack of knowledge. So when we have these town halls and we start talking to faculty and staff and educate them about what we're doing, what we're trying to do to protect their health and well-being, many times their fear and anxiety actually go down. So we kind of felt like in the beginning that fear and anxiety was about being on campus, but in fact it was more that they just didn't know what was happening in the community, what was going on our campus. So the more we pull these individuals into the planning, the easier it has been. So we're sure that there's going to be others that are going to have the fear and anxiety, but we're going to work through that and support them as best as we can.
Okay, thank you so much. So the panelists and I are going to take a pause and turn this event over to our sponsor interview for about 10 minutes. The panelists and I, we're going to turn off our video and our sound, and hopefully we'll remember to turn on our video and our sound after the sponsor interview, and we'll get right back where we were from there. Okay, take it away.
Chronicle, and I'm here today with Dr. Dr. Kimbrough is a primary care physician based in Washington, D.C. He has a background in public health as well. Welcome, Dr. Kimbrough.
Thanks for having me, Liz.
Yeah. On Medical is a network of medical providers, and it does work in recent months in helping workplaces develop plans to go back to work. Can you talk a bit about what you've learned from those experiences and what some of the best practices are that colleges should be thinking about as they prepare to bring back their faculty, their students, their staff?
Sure. So just as a starting point, One Medic was a primary care, just as sort of the core of our identity. So we've got brick and mortar practices in 13 different cities across the country. But we also have our own tech platforms. We've got our own app and a virtual platform as well. And so when this pandemic started, we really worked quickly to try to pivot and leverage all of those existing tools to help respond to the pandemic. We added testing capability, which, of course, was a new thing for everybody through this process. And so our operations team learned how to quickly set up testing sites and also help support at-home test kits, so mail delivery test kits for COVID as well. But one of the big things is that we thought about the design of all this through the lens of primary care. So always thinking of the individual and thinking of how to reduce their risk, how to get them back to wellness after they get infected, all of those factors as well. But through our experience, so we've worked with lots of different companies so far, just because the private industry has been a few months ahead on the concept to reopen. And so we've worked with lots of different size companies and companies in different industries to think through how to bring their workforces and their employees back in a risk-reduced environment. And so now for the past month or so, we've been working more with schools and thinking about how to bring all those same tools and same learnings of how to safely bring people back into the workplace, only into a campus setting instead.
And based on those experiences, do you have reservations about people going back to campuses?
I don't think any more reservations than anybody else. It's definitely an important concept that there's no such thing as risk elimination. The very best we can do with this is risk reduction. And it's also important to remember that our schools are, it's part of the communities. And so the more COVID disease burden there is in the community around the school, the harder it is to think about risk reduction in the school itself. Of course, every campus can be different in terms of how integrated it is into the community around it, how much extra space there to socially distance in the classrooms, and frankly, how much resources there are to support testing and more aggressive risk reduction measures like that as you bring these groups of people back onto the campus.
Mm-hmm. And can you just talk about the fundamentals that colleges need to have in place as they bring people back? Whether it's
Sure.
Testing capabilities, tracing, isolation possibilities.
Definitely. So one of, all of the same risk reducing sort of functions that we've learned so much about in the past few months, just as a society through all the shelter in place, all of those ideas still apply as we start to bring people back as well. So reducing density in public places, doing as much stuff outdoors as possible, really thinking about the air circulation, ventilation, filtration, all those things in indoor spaces, face coverings, so wearing masks, having those be worn as much as reasonable, especially in indoor spaces, hand washing, just all of these steps together, each one incrementally reduces the risk. A few of the tools that we've put a lot of effort into developing are daily symptom checkers, where basically we ask each individual, so that would be the students or the staff and faculty, to, before they start interacting with other people in the morning, really sit down and take a moment to pause and say, how am I feeling today? Have I had any risky exposures? Have I done any travel? Do I have any of these symptoms that might be a sign of COVID? Just because there are so many, even mild and sometimes vague symptoms that, we do see people say, oh, it's just a stuffy nose, I'm sure I'm fine. We recommend a test. A good bit of the time, those are coming back positive. So it's really hard for people to sort of self-assess their own risk. And so we've built tools to help sort of guide that risk assessment. And then, of course, the testing is another big part of it. The CDC just this morning re-anchored to 40% as the number, and that's that 40% of cases of COVID are spread or sort of triggered by people who don't have symptoms. Mm-hmm. And that really highlights just, what a daunting task it is to try to track this down. If you can only rely on symptoms to catch 60% of the spread, the rest of the 40, that's really through all the other risk reduction with the masks, the hand washing, all that. And also that's where testing comes in to help find those asymptomatic cases, get them into isolation so that they don't spread to other people. And so, we really think of, if it's reasonable and feasible for a school to test everyone before you bring them back to the campus, and then to have a really robust tracking system in place so that, if there is an outbreak, you've got reasonable ways of getting in touch with everyone who might have come in contact with that sick person.
So you just mentioned patients with no symptoms. Are there any age differences among asymptomatic patients or people who are not showing visible signs?
The data has been a little bit hard to track down on that specifically. In Iceland, there was a large series where they saw that young kids actually didn't have much disease at all. But then over the age of 10, they had this similar rates of infection as adults and everybody else. There've been a couple of smaller studies that suggest that young kids might actually have very mild low-level infections but carry it for longer. And so basically, as with so many things with COVID, the jury's still out on exactly how to interpret the data on younger people and what it means for transmission.
Mm-hmm. What about international settings? Are there lessons there that colleges can be thinking about?
Absolutely, and unfortunately that gets into sort of that same tough conversation around, the risk of a school really is composed of the risk of the community that it's in. So when you look internationally, especially South Korea, Taiwan, there's lots of good examples to look to where we can find how schools have been safely reopened and really controlled the spread of the virus in those settings. The problem is that there's not a lot of places in the US where the surrounding community area is as low as it is in those countries. And so it's really hard to extrapolate and say that schools will definitely be as successful here as they were there, unless we have similar low levels of community spread around the schools themselves.
And you mentioned those neighboring communities, and I think of a place like Florida right now. And does any of your thinking and advice differ if you're in a place where there's a very active outbreak?
There's sort of a natural tendency to think of these phases of reopening as a linear path. Where, well, we're in phase one, so we must go to phase two, and then we must go to phase three. But the reality of it is, I think the governor of California has been using the analogy of a dimmer switch rather than a light switch. And as we saw just today and yesterday in California, in a lot of places, they're actually scaling back in terms of reinstituting some of the restrictions from the shelter-in-place orders. And so I think that, you know, it'll really depend on the local governments and sort of local leadership to say, you know, what are the regulations that need to be in place in the broader community, but definitely does impact the risk of any one particular school. You know, if you've got really high rates of community spread around you, unless it's a really completely closed environment, which of course most schools aren't, it's going to be really hard to keep that risk from making its way into the campus setting as well.
Do you have any advice or insights into the whole behavioral piece of this? You're bringing potentially large groups of students back together who've been cooped up for months. How can you possibly enforce some of the, you know, those social distancing or just general kinds of common sense guidelines that they should be following right now?
Sure. So I think there's two sort of approaches to that. One is just acknowledging that the mental health burden here is a real, you know, as a primary care practice, we've seen about a 5x increase in call volume just about anxiety, depression, and, you know, all the sort of anticipated burden of mental health from COVID itself. We also anticipate things actually worsening rather than improving with some of this reopening, just because so many people have this optimism of, if I can just get back to school, if I can just get back to work, it'll be back to normal again. And of course, you know, as we just covered, you know, even if a school has just the bare minimum amount of risk mitigation strategies in place, it's still going to be mass. It's going to be less dense campuses. It's going to be all these different rules and just a very different feeling than it was before. And so we really anticipate the mental health burden of this continuing rather than improving as things start to reopen. And so, which is why we as a practice are sure to ask about it. You know, when we're working with organizations, we build in sort of the tools and the surveys to be able to ask how people are doing with it and get them tied in with resources if needed. We also work really closely with student health centers to make sure that we're using all the tools and resources that are already there and really sort of tailored for students and school communities.
Mm-hmm. And as college leaders think about going back to campus, I'm curious, do you have any advice for them?
That's an ambitious one. I think that one of the things that we've seen with employers so far that sort of differentiated companies having a lot of success and others sort of struggling with bringing employees back into the workplace is how much you leverage your culture. And so, you know, if you're able to instill a culture of wearing face masks, of taking reasonable personal accountability for, you know, to wake up and you're not feeling well, that you self-designate through the app that you're not feeling well and, you know, sort of raise your hands to be treated and get the medical attention you need to really reduce your risk there. You know, maybe keeping students in cohorts, smaller cohorts of 10 or 15 people rather than large parties of hundreds plus, which makes contact tracing pretty much impossible. People are socializing in really large indoor gatherings. All those things, which, you know, as I say it, I know are really tough to do, especially in an undergrad setting. These are the things that will really set a school up for success, is, you know, getting the buy-in and the participation of individuals on campus.
So thank you so much for your time, Dr. Kimbrough, and for your support of this event.
Thanks for having me. And, you know, it's so great to have a place to sort of talk about the facts and, you know, help guide some thinking in this, just because I know that there's been so much sometimes conflicting information about the disease. And so, you know, really glad to be a partner in these conversations.
Okay, folks. So sorry about that. We had some sound issues with the video early on, but if you came in the middle of that and were wondering who that was Will Kimbrough of One Medical talking to the Chronicle's own Liz McMillan. So let's dive right back in where we were. I have more questions for you, but we have some great questions coming from our viewers. So I'd rather just get into those. A viewer named Joanne asks, do any of these schools have established levels where they will go over to full remote instruction or close certain areas? If so, how are they quantifying the levels and what guidance are they relying on? So I think what she's asking there basically is, are there tripwire numbers where you all will feel like you just need to shut things down and send kids home?
This is Debbie from the University of South Carolina, and I don't know that there's any way that you can put a number or something that defines that if there's this many or that many. I think it's looking at the totality of what's going on your campus. So when you look at the epidemiology, what is going on your campus, what's going on into your community based on the numbers, and maybe you can decide a % increase in cases or decrease in cases depending on what has to happen. The other thing is, do you have adequate quarantine and isolation space for students to be able to be quarantined and isolated? So again, I don't know that there's a number on that. The other thing is looking at what is the surge capacity of the student health center? Are they able to handle the illnesses that may be on campus and continue to provide that day-to-day care on campus that all the other students who are not COVID related? The other thing we have to look at are resources in our community. Do we have enough PPE? Are we able to transport our students from the local area onto campus? So I don't know if there's any way that you can put a number on any of this. I think you just have to look at, these are our trigger points, and then maybe put a scale on these trigger points and say, well, this one is the most important thing that we need to look at. And then perhaps when you look at a scale and say when 3 or more of these criteria that we've set up are in an alert level or have exceeded, then we need to look about going online or reducing the number of campus. So I don't know about the other panel members, but we found it extremely difficult to have a number on anything.
I would agree with that. Certainly there is no hard trigger point. And especially in an urban environment like we're in, you have to consider the capacity of the local healthcare system, of the public health authorities that have to do the contact tracing, and all of the other factors that go into responding to an outbreak. So there's no hard, fast number, but it'll be a constant evaluation and reevaluation of what is going on in our environment.
And I also agree with Deborah and Rob, but also as we're going into the fall semester and we're thinking about the flu season that is coming up for us, not just on college campuses, but across our country. And if we make a threshold now, it could be too low, it could be too high. And so I think right now all campuses are operating under flexibility and pivoting very quickly to make sure that we're keeping our campus, not only students, but staff and faculty safe as well.
Yeah, oh my gosh, the idea of sorting out COVID symptoms versus flu symptoms. And you guys have an adventurous fall ahead of you. Let me move on to a question from Joyce, who was following up, Samantha, on your point about what students can do and cannot do. And she was wondering if you can give some examples of what they can do. And I guess, I mean, this sort of pivots over something I was thinking about too and have discussed with you all, which is, how do you make this semester for the students who are on campus not like a monastery and not like a minimum security prison? How do you have some culture and life and fun and still keep the health guidelines that you need to keep?
So when we're saying things like what students can do, one thing, an example that comes to mind that I've gone over with my colleagues are things like study groups. Some students need a study group so that they can perform well in their class. They learn well from each other. At UMBC, we do a lot of work with peer-to-peer education when it comes to whether it's health and well-being or it's your organic chemistry class. And so we're letting our students know you can still have a study group. Here is how we have a safer study group. We don't want you to eliminate those things. But in terms of fun, we still want our students to have fun. And so I tip my hat to our campus life staff who are trying to actually translate our UMBC traditions into a virtual format. So we will still have Welcome Week. And you will still get to see the faces of the staff and administration who are going to be helping you throughout this semester. Our help will look different, but you will still get to see us. We will still try to have visuals of the buildings and facilities that we will have because some students will interact with them. But also for some of our students who are in the residential space, while that residential space is going to be restricted to only students who are residential, we will still try to have some physically distant events and programming available to them because we don't want them to become stir crazy. And so at UMBC, we typically use the term physically distant instead of socially distant because we are still UMBC together. We're just about 6 feet apart from one another while we're together.
Got it. Thank you for that.
Maybe like something on a plaza where we can have chairs situated out and project a movie onto one of the buildings are things that we're considering and thinking about.
Yeah. Anyone else want to chime in on that one? Tell me what you have planned for your campuses. We can move on if you don't, but feel free. Let's move on then. I have a question from one of our viewers asking for small campuses, maybe isolated rural campuses that might not have a lot of resources. What are some other options for testing? I guess one thing this viewer might be thinking about, I don't know, I'm reading minds a little bit here, is are there vendors, are there outside services, are there other approaches that campuses that don't have, say, what you have, Angela, at UCSD, the benefit of a huge health and hospital system, what else might they do? And I'll open that up to anyone.
I think it's a really tough question for some of the campuses that are not connected directly to a health system. The commercial labs, a number of them are being overwhelmed. And so I think you have to look at your commercial labs, what's available in your region, and then reach out to the hospitals. Even though you may not be officially connected to them, they realize that if your students become really ill, they're going to come in their doorway. They may be able to help you and provide some testing capacity. So I would try and look to your community, all the healthcare options in your community for more testing.
So even if they're not official partners, talk to the people in your town or county and get to know them, right?
That's the best thing.
I'll say that at UMBC, we partnered heavily with our state and county health department to support us. And that's something that we are capitalizing on from our normal run-of-the-mill year, where we do some work with them to maintain the health and well-being of our students. And so I would tell that school, please connect with the health department because they may have access to resources and additional staff that can be deployed in your area to support your campus.
Got it. Let me just mention to folks, if you had trouble hearing that video because of the sound problems, when you get a link from us, a follow-up email within the next couple business days, you will get a link to that video and the sound will be good and you can hear whatever you missed there. So we've talked a lot about the physical plans, but less so about mental health issues so far. Again, I would toss this out to whoever wants to have at it, but what kinds of mental health services and safeguards can you offer your students this fall? And what part will teletherapy play in those arrangements? Because even students on campus, whether it's a question of safety and medical guidelines, or maybe just a question of they've gotten used to teletherapy and like the accessibility and privacy of it, maybe they want that. I guess another way of putting it is, how has your mental health approach towards students may be different than pre-COVID?
We've virtually switched almost all the individual therapy to remote. And it's worked extremely well. It's a video platform that's very secure. It's been a great, the switch to that went smoothly and the students really like it. They get flexibility of hours. It's helping some of our CAPS providers who now have children at home because of school. They can do evening sessions. So the video telemental health has been a great help to us and well accepted by the students. We also do a lot of special tips and programs, workshops that students can join into. So trying to create other venues. And on campus, we've kept our urgent care facility because we still do have some students living on campus. So access to in-person urgent care is there as well. So the need is there, and there's no question this has been really hard for the students, but we've been able to support them pretty well through the process because of telemental health.
We've also switched completely to telecounseling, and it has been really well received by our students. In fact, our volume of clients has not decreased significantly. And we will continue throughout the coming fall semester in a telecounseling only mode. One of our primary concerns regarding the mental health and the well-being of our students is those residential students who will be in quarantine or will have their movement restricted either at the beginning of the year or throughout the process of their residence, where they might be exposed to a positive and we need to have them placed in quarantine. So we're working very hard on how to keep that connection with those students, how to, one of the concerning things obviously is by putting someone in quarantine, by definition, you're not observing them, day in, day out. They're not out in the hallways or interacting with their residential staff. So we need to have a really robust system in place to keep that connection. And one of the ways we are hoping to do that is by really ensuring that they're aware of what resources we have and the way of counseling and other healthcare options as well.
And if I remember, Rob, you were saying that that you're not leaving that part of it to chance, that campus health staff will make a point of, I can't remember if it was daily check-ins, but at least regular check-ins to make sure that students are, not only getting whatever nutrition and medical help they need, but also aren't going too stir crazy and aren't feeling that isolated.
Absolutely. I think we have to commit to having daily contact with every single resident. In our case, they will all be in single room occupancy, right? So they are going to be feeling particularly isolated at a time at the beginning of the semester when we know from experience that is when they start to have different, adjustment problems, anxiety, homesickness, and all those other things that are normal. Well, I think that will be compounded by this sense of isolation. So we do have to pay a lot of attention, not just from the recreational side of things, which is very important, but also from a mental health, well-being, physical well-being aspect as well.
Right, yeah, and especially for freshmen, I would imagine that would be a heck of an introduction to college, right? Coming in,
Exactly.
getting a positive COVID test, saying, hey, guess what, you're going to be in your room for 2 weeks by yourself. That would be, woof. Let me
Can
ask.
I add something?
Yes,
Yeah.
please do. Thank you,
Just
Pam.
very good. No problem. Ditto to much of what has been mentioned in terms of daily checks. I want to add a couple other things. We're doing, and I think most of my colleagues probably are, we're also looking at the mental health of our employees. So our wellness center has also, will be offering and making certain things available. We're going to be talking about, as some of you may, we have a colleague development days about the mental well-being of our students and educating staff and administrators And although not a topic that we often talk about, we're also doing a session on suicide prevention training as well. And again, trying to think of trying to educate our university community about some of the signs. Again, it could be an advisor, it could be someone else. And then we do have you're talking about mental tying in and working with our fitness center, because that sometimes helps. And then we have an advantage as a private university. We also have a spiritual or pastoral care component as well. And
Right.
so there, and some of you offer similar kinds of help. So lots of different prongs that can assist individuals.
Yeah, I'm glad you mentioned the suicide prevention efforts, especially because when I think about the reporting that we've had in the Chronicle about things like the Jordan Porco Foundation, so much of the suicide prevention approach has to do with peer monitoring, peer counseling, just students keeping an eye on each other. And when they are distanced that way and have less contact, I would think that would be one thing that could go a little bit askew if colleges aren't watching it really carefully.
Alex,
I just want to add really quickly is that at UMBC, what we're also working on is letting our staff know that it's not just the health and counseling staff's responsibility to think about the mental health of our students. And so
Yeah.
our faculty, also folks in our campus life area who do our student activities, to also make themselves aware of the resources that are available, that we're doing telehealth and telecounseling, but then also to create a strong referral system so that they know exactly how to get students over as soon as they can. And then also recognizing signs and symptoms in the virtual world about how we can get students connected to help as soon as possible. And our parents and families have been very important, because we need to empower our parents and families, because some of our students will still be at home, about how to recognize signs and symptoms in their students and how to get them either connected to help on the campus or help in the community.
Right. I've got 2 kids in college. Don't forget about us parents. We can be helpful every now and then for things besides signing checks, right? Debbie, I think you wanted to say something too there, right?
Yes, in addition to all the great programs that the panelists are having in the psychiatry, telecounseling, a couple of things that we're doing as well is that we launched a resiliency project about a year ago with our students within the residence halls, teaching them how to be more resilient, how to fail successfully in a sense. So we've actually expanded that significantly through this fall, and we have a work group with our faculty, staff, and students that's working on expanding all of that. The other thing that we have in place and have for a couple of years is we actually have a behavioral health specialist embedded into our primary care and into our medical pods. So we do the depression screening, the PHQ-9, with everyone who walks in, and we're able to immediately get that student who may be in this fall, whether it be COVID or other symptoms. We immediately try to get them with that behavioral health specialist. And we have that set up to where it will be physically distanced, and that counselor will be protected in the event that there is someone who is positive for COVID. So I think mental health is going to be so critical on our campuses. It sounds like all of us together really need to continue these programs to make sure our students and faculty and staff feel safe. And I also had sons in college too, and it was very important that my son's mental health was taken care of as well. So we certainly need to continue those efforts.
Yeah. Let me ask, the pandemic has hit underrepresented minorities hardest. Add to that the trauma of racial strife. How can colleges make a special effort, especially given the necessity of social distancing, to look out for signs of distress in those students particularly? And what practical measures can be offered to make those students' lives easier this semester? Again, I would throw that open to anyone on the panel there. I mean, I guess one way of putting it is we've been talking about the general mental health screening and things that you're going to be watching for. Are there special programs? Are there kinds of special attention that colleges would be wise to have toward underrepresented minorities whose families might be hit hardest by COVID, as well as, you know, the millions of people who have lost their jobs, so financial, medical, other issues?
Sorry, my computer link did not allow me to unmute myself quick enough. I apologize for
dear.
that. So that's okay. So one of the things that we have really started working with, even through our resiliency project, is looking at those targeted populations throughout our campus that may be underrepresented, looking at programs going into those areas. Our counseling center has just done a lot of great activities and programs, you know, to reach the minorities. We'll also have a faculty member who's working with health disparities, working to help us with our communication efforts so that we are reaching out to those individuals to make them feel like they are extremely important. We want them in our facilities, we want them in our care, and that we are able to provide that additional resources. So we do have a lot of programs in a group working on a lot of those health disparities here in our city and on our campus.
We're doing some other effort. I mean, again, we're trying to weave some of that into some of our current programs because you'd like to build new programs, but you have to expand others. So having a program focused on first generation, for example, and thinking about that in certain terms, we've done in many of, again, I'm sure the panelists here, we did a student survey to try to determine the kind of technology that folks need, because we were concerned about access to technology as we sent individuals home or as we're teaching online. So making, providing some financial resources to students, trying to help them determine what they need. And one thing, as an example, we have a site now trying to tell students what kind of technology they need, all the different resources so that they can take a course online and have the right computer or the right accessibility. And I think some of the things, and other folks, whether it's our student life office or our residence life, we're going to be identifying, we're calling it right now a multicultural advisor in the dorms, but focusing a little bit on that in terms of specifically dealing with both underrepresented minorities and other groups that we see, some international students and such, but placing those folks in the dorm so that we can better identify. And we know many folks won't be in the dorm, but trying to balance that with other services. So, and training, which many of you trying to look for signs and symptoms, as it were. So those kinds of efforts.
Mm-hmm.
I would also say we're capitalizing on the safe spaces that our students had when they were on the campus. And so a lot of our cultural student organizations will continue to have meeting times in different formats throughout the upcoming semester. And so one thing that I've actually encouraged the rest of our Division of Student Affairs staff to do is to train their student leaders in those areas so that they can keep those safe spaces, but we also empower the student leaders to recognize signs and symptoms of mental health concerns within their groups, and also the advisors for those student organizations, so that one, we can get students over to help in a timely fashion, but also we are expanding what help looks like, because we know that some students on our campus are coming from cultural backgrounds where speaking to a psychologist or a psychiatrist is a foreign concept. And so expanding what we call help for students is also going to be how we recognize that racial and ethnic minorities are at a higher risk right now, but also making sure that we are giving them appropriate help that will then encourage them to sustain and help themselves in the future.
Mm-hmm. We're running a little short on time, so I guess I would go around the room and offer each of you, if you wanted, a chance to sort of point out that one most key factor in terms of not just student, but also faculty, staff, health, as we get into what promises to be a roller coaster of a semester. Maybe can we start with you, Angela?
I think it would be communication at all levels. This is dynamic. We have to be adaptive. The science is changing. Our communities are changing. So creating forums and many different ways to communicate with our campus community is critical to get through this together.
Thank you. Debbie, how about you? Any sort of final thoughts for us?
I think the most important are partnerships within the community. Whatever the university decides to do, whether they're back or they cut back on hours, we've got to have our local, state authorities involved in our decision making. So we got to work with our hospitals. We have a great resource with our School of Medicine. So it's just a huge partnership, and we all have to work together and come up with a common plan that is comfortable for not only the campus, but our community that surrounds our campus.
Yeah, no institution is an island this fall, right? How about
That
you?
is correct.
Any final thoughts? Samantha, that goes to you
Oh,
if you
okay.
want.
I'm sorry.
Sorry.
Couldn't hear my name for a moment. I would just say normalizing that it is okay to not be okay. Things are changing rapidly. We are staff. We are people. The COVID or the flu or whatever or stress, anxiety can impact us as much as it is impacting our students. So the more we can normalize that it's okay to not be okay, to extend grace with one another as we are traveling through what our foreseeable future could look like, is one thing that I'll encourage folks to do.
I hear that. Yeah. How about you, Pam?
I would say the best way I could capture it is intent and impact, that we're all trying to develop policies and protocols. And what's very clear to us may not be very clear to others. So to try to look at things through different lens and realize that, and folks talked about this, hear different voices. You know, how are we doing? What do we need to do better? What do you have a question about? You know, how can we help you? So just making sure that there's good communication, but trying to hear all those voices and see how folks are hearing, observing, and acting.
Very nicely put. And Rob, how about you?
I would say that the health and well-being of the community is a shared responsibility. So no one should come onto campus thinking it is health services responsibility or the administration that is responsible for this. We need to have empathy, take care of each other, and do everything we can to protect those around us.
Got it. Thank you for that. I want to thank again One Medical for underwriting today's presentation. We appreciate their support. And big thanks to our panelists for joining us, and a big thank you to all of you viewers as well. A last reminder, today's session was recorded, and we'll be sending an email with a link to the on-demand version in a few days. And again, that will include the sponsor interview video with some better sound than we had just now. And with that, for the Chronicle, I'm Alexander Kafka, and we look forward to seeing you again at our future Chronicle events. Thanks for joining us.